Evidence-based practice is an approach to decision-making in various fields, including physiotherapy. It involves high-quality clinical research conducted in clinical setting through experiment and observations. High-quality clinical research is expected to have low risk of bias and allows us to trust the results. It involves integration of two components, that is, patient preference and practice knowledge, which includes physiotherapist expertise. Traditionally, physiotherapist alone was involved in decision-making process, but today the consumer involvement has increased. It helps develop better communication, empathy, and flexibility in context to risk and benefit of some particular treatment. Evidence-based practice started to evolve in 1980, during which studies were conducted on clot-busting drugs for heart attack to reduce mortality. In 1990, literature was present on various issues like ineffectiveness of bed rest in acute low back pain, but it was still not practiced. In 1991, the Director of Research and Development of Health in England emphasized a knowledge based on information rather than belief. In 1992, the term evidence-based practice was introduced at McMaster University, Canada, along with establishment of Cochrane collaboration. And in 1999, Pedro was introduced that gave access to high-quality clinical research in physiotherapy. Evidence-based practice is important from three perspectives. The first one is of physiotherapist. It helps develop trustworthiness and set a ground for high ethical standards that aim to benefit patient. It also develops professional autonomy. The second perspective is of patient. High quality research allows safe and effective treatment, plus patients are exposed to a variety of treatment options. The third perspective is of funders, that is, they are eager to ensure value for money and customers attain maximum health benefit where health resource is minimal. Various other factors affect clinical decision making, which includes availability of resources in context to time and equipment. For example, some effective intervention for a specific problem could require a large amount of staff and expensive equipment. The skill of physiotherapist also matters a lot, so he can provide safe and effective treatment. Clinical setting and cultural influence also affect clinical decision making. Evidence-based practice involves the following steps: converting information needs into answerable questions, tracking down the best evidence with which to answer those questions, critically appraising the evidence for its validity, impact, and applicability, integrating the evidence with cultural expertise and with patients' unique biology, values, and circumstances, evaluating the effectiveness and efficiency in executing steps 1 to 4, and seeking ways to improve them both for next time.